Maintaining good oral hygiene is an important aspect of overall health. Brush twice a day and floss regularly. If you have certain cardiovascular conditions, you should inform your dentist about any medications you are taking. When it comes to dental care, people with heart disease have unique requirements. If you have one of the following heart conditions, here are some things to think about before going to the dentist. Hello, this is Scope Care, and for today's video we will talk about the connection between your oral health and heart health. But before we start discussing this matter, if you have not yet subscribed to the channel, please make sure to do so you will not miss our knowledgeable healthcare videos. Some heart failure medications, such as diuretics or water pills, can cause dry mouth. Inquire with your dentist about dry mouth treatments, such as the use of artificial saliva. Things to keep in mind regarding dental care and heart disease. Give your dentist a complete list of all the drugs you're taking for your heart condition, as well as any other prescription or non-prescription medications you're taking. This will assist your dentist in determining the best treatment plan for you, including medications to be used during dental procedures. Give your dentist the name and phone number of your doctor or doctors in case your dentist needs to contact them regarding your care. Discuss your concerns with your dentist and heart doctor if you are particularly anxious about undergoing a dental procedure due to your heart condition. Your doctors can provide you with information and work with you to develop strategies for managing dental pain and reducing anxiety. Is there a link between periodontal disease and cardiovascular disease? Various researchers and government agencies are still looking into the possible link between gum disease and heart disease. Some researchers believe that bacteria in the mouth that cause gum disease move into the bloodstream and cause inflammation in the blood vessels, contributing to heart disease and stroke. Several studies are being conducted to support and refute the possibility of a link between these two diseases. One study published in Stroke, Journal of the American Heart Association, discovered that people with fewer than 25 teeth at the start of the 12-year trial had a 57% higher stroke risk than patients with 25 or more teeth. Another study with over 4,000 patients and 17 years of follow-up found no evidence of a lower risk of coronary heart disease if chronic gum disease was eliminated. Based on these findings, the researchers hypothesized that the link between gum disease and increased cardiovascular risk is purely coincidental, and that gum disease does not cause coronary heart disease. Researchers and government agencies are still looking into the link between periodontal disease and cardiovascular disease. However, according to some studies, bacteria in the mouth that contribute to the development of periodontal disease can enter the bloodstream and cause an increase in C-reactive protein, a marker for inflammation in blood vessels. These modifications can, in turn, raise the risk of heart disease and stroke. There is research to support and refute the possibility of a link between periodontal disease and cardiovascular disease. More research is needed to determine how the two may be linked. Maintaining optimal oral hygiene is an important component of your overall health. The true role of gum disease in heart disease, if there is one, has yet to be determined. What are the advantages of good oral hygiene? By taking good care of your teeth and gums, you can reduce your chances of developing dental decay, gum inflammation, and oral infections, such as abscess formation. Optimal dental care includes seeking professional dental care every 6 months, brushing your teeth at least twice daily, regularly flossing your teeth, and making sure dentures fit properly. What should you tell your dentist if you have cardiovascular disease? First, provide your dentist with a complete medical history and a list of the names and dosages of all the medications you are taking for your cardiovascular condition, and any other prescription or non-prescription medications you may be taking. This will assist your dentist in determining the best treatment for you, including the selection of medications for dental procedures. Second, as mentioned before, provide your dentist with the names and phone numbers of your doctors if your dentist needs to consult with them about your care. Third, consult your dentist if you are particularly concerned about undergoing a dental procedure because you believe your stress, worry, and fears will aggravate your cardiovascular condition. He or she can give you information and work with you to develop strategies to control dental pain and alleviate your fears. Hey there! We hope that this video helps you to expand your knowledge when it comes to your health. If it does, please make sure to give this video a thumbs up. And feel free to share your thoughts in the comments section down below. What cardiovascular diseases necessitate special attention? The list below contains information about some of these conditions, as well as the precautions you should take if you have them. Please keep in mind that this is not an exhaustive list of conditions. Talk to your dentist if you have any questions or concerns about dental care and your specific cardiovascular condition. For example, if you have cardiovascular disease and require oral surgery, talk to your dentist or surgeon about pain management options during and after the procedure, including the use of anesthetics and sedation. Endocarditis. Some people are predisposed to developing an infection of the heart's inner lining. As a result, these patients must take extra precautions to maintain good oral hygiene daily. Many of these patients were previously advised to take antibiotics before having dental work done. However, the American Heart Association revised their guidelines to state that only people at the highest risk of developing bacterial endocarditis will benefit from taking preventative antibiotics before certain procedures. Learn more about endocarditis in those who are at high risk. Your doctor will be able to tell you if you are in the high-risk category. All patients scheduled for valve surgery should practice good oral hygiene and see a dentist before the procedure, because unhealthy teeth are a source of bacteria that can cause endocarditis. The heart attack or the myocardial infarction. It is best to wait at least 6 months after a heart attack before undergoing major dental procedures. However, you do not have to put off getting your teeth cleaned. Inquire with your dentist about the availability of oxygen and nitroglycerin in the event of a medical emergency during your office visit. Anticoagulants and antiplatelet agents. Inform your dentist if you are taking anticoagulants or blood thinners, such as warfarin, also known as Coumadin. These medications may cause excessive bleeding during certain oral surgery procedures. In addition, many patients with cardiovascular disease, particularly those with drug-eluting stents, take the antiplatelet medication clopidogrel, the Plavix. Never stop taking Plavix without first consulting your cardiologist. High blood pressure, hypertension. Some antihypertensive medications can cause dry mouth or interfere with your sense of taste. Calcium channel blockers in particular can cause gum tissue to swell and overgrow, causing chewing problems. If you do have gum overgrowth, your dentist will give you detailed oral hygiene instructions and may require you to visit the dentist more frequently for cleanings. Gum surgery, while uncommon, is occasionally required. To remove excess gum tissue, a gingivectomy procedure can be performed. Excess gum tissue is removed with a scalpel, electrosurgery unit, laser, or diamond dental burrs during this procedure. Angina. Patients with angina who are taking calcium channel blockers may develop gum overgrowth. Gum surgery may be required in some cases. Patients with angina, like patients with a history of heart attack, may want to ensure that oxygen and nitroglycerin are available in the dentist's office in case of a medical emergency. Although patients with stable angina can typically have many dental procedures performed, patients with accelerating or unstable angina should not have any non-essential or elective dental procedures performed. Before undergoing such procedures, these patients should have their hearts evaluated by a cardiologist. Patients suffering from unstable angina should seek emergency dental care in a hospital equipped with cardiac monitoring. Stroke. If you are taking anticoagulants, inform your dentist. Some oral surgery procedures may result in excessive bleeding if these medications are used. If your stroke has left you unable to produce an adequate amount of saliva, your dentist may advise you to use artificial saliva. Your stroke may have affected your face, tongue, or dominant hand and arm. In that case, your dentist may also recommend fluoride gels, modified brushing or flossing techniques, and oral hygiene strategies to help you maintain good oral hygiene. Let's now discuss prevention measures. The best way to avoid gum disease is to practice good oral hygiene and have regular dental examinations. The American Dental Association, also known as the ADA, Mouth Healthy Site, recommends brushing your teeth twice a day with a soft bristled brush that fits your mouth perfectly so that it adequately reaches every tooth surface. The ADA also recommends using ADA-accepted toothpaste, which has been shown to improve gum health in 4 weeks. You should also floss every day and see your dental hygienist regularly for professional cleanings. By being proactive about your oral health, you can prevent a link between oral health and heart disease, and keep your smile healthy, clean, and beautiful for the rest of your life. And that's it for today's video. Please make sure to subscribe to the channel and turn on notifications to be notified of every new upload. This is Scope Care, and we will see you in our next video.